Hello there, I'm Fiona Godlee, Editor-in-Chief of the BMJ, and I'm delighted to be speaking to you from Geneva, from the WHO's first global conference on air pollution and health. And we have a panel here to discuss the Unmask My City initiative. And I'm going to ask the panel members to introduce themselves, and I'm hoping, I gather, there will be questions coming from you that we can put to the panel. So, without more ado, let me invite the panel to introduce themselves. And if you could, each of you say, as part of your introduction, why the health sector is a leader for change in air pollution. Neira.
Hi, thank you, and hello everyone. I'm Maria Neira, and I'm the Director of the Department of Public Health and Environment at the World Health Organization. And it's not that I think we need to have a role, it's that it's a moral obligation that the health sector will have a role. If you look back in society, the big changes on water pollution or sanitation, they all came because of the health argument. So I'm very much convinced that even on air pollution, the health sector will play an incredible role on changing the society and bringing them to the good things.
Thank you very much, Maria. Arvind.
Hi, I'm Dr. Arvind Kumar. I'm a chest surgeon at Sir Gangaram Hospital, New Delhi, India, and I'm also the founder trustee of Lung Care Foundation, India. Regarding health sector as being the driver of change, I think nothing is more precious to anyone than health. If you go tell someone that this is going to cause this, he may or may not respond. But if you tell him that your health is in danger, and more importantly, your children's health is in danger, he is going to respond instantly. So I think huge role there, positive role for health sector as far as change in air pollution scenario is concerned.
Thank you very much.
Yeah, well, good afternoon. I'm JP Amaral. I'm from São Paulo, Brazil. I am co-founder of an NGO called Bike Anjo. It's an international network of passionate cyclists who engage people to use bicycle as a way to change cities. And we believe that changing cities, we change the world. And we also part of, I'm also part of the bicycle mayor network around the world. And I am the bicycle mayor of São Paulo. And the reason why we're connecting with the health sector now, together with the campaign we did with the global call for climate action, is that we believe that the benefits of active mobility, and especially when you talk about transportation, goes to the health sector. So this is not only a belief, but for example, in the European Union is more than 40% of the economic benefits of cycling goes to the health sector. So it's more proper to say that they also have a role on acting in mobility policies and also air quality consequently, right? So I think that's a good combination.
Thanks, JP. So we have a question from Martin in Canada, who asks, how does air pollution affect people from different socioeconomic backgrounds, and what difference do you think the WHO conference will make, especially for the more vulnerable communities in our cities who are affected by air pollution? Arvind, what would you say for that?
The first part was, how does the air pollution
affect people from socioeconomic backgrounds?
So air pollution is something which affects people from all socioeconomic backgrounds, but I think the worst affected are the economically deprived people. Why? Because number one, their level of exposure is higher. Their ability to cope with the consequences is also lower. For example, if I'm very rich and I get some complications, some asthma, I can have access to the best healthcare facility, but if I'm from an economically weaker section, I may not even be able to get the treatment. So they get more disease, they do not get treatment, and hence they face worse consequences.
Maria.
How WHO can contribute to mobilize and to tackle this problem of air pollution? I think the health argument, as previously expressed here, is probably one of the most powerful. So if we use it properly, and here the evidence is such that we are saying that we have 7 million deaths every year. I mean, I need to, anytime I say it, I need to repeat it because it's unbelievable. We are dying because we are breathing. So the price of pollution is paid by our lungs, by our brains, by our heart. So it's absolutely unacceptable. So WHO has convened this conference with the best experts, with NGOs, with editors of journals, with ministers of health, energy, environment, civil society, Everyone is mobilized. Moms for Lungs, I mean, as you say, for me, I've been convinced for many years that the moment you introduce the word asthma on the climate change negotiations or on the air pollution discussions, that day everything will change, because the day a mom will realize that the air we are breathing is linked to the health of their children, then can be the mobilization and the action and the power of that group can be really very powerful. So WHO is putting all the pieces together: science, interventions, solutions, good examples from other countries, proving that action is possible without destroying the economy. At the contrary, you can take a lot of actions and don't use this excuse that saying, oh, our progress and our development will be at risk if we don't pollute. That's not correct. So on the name of health, we need to do it.
Thanks very much, Maria. I'm interested in the whole bicycle thing, JP, because in some ways bicycles were originally, you could say, the mobility for the poor. Then they've become very middle class, haven't they? And the idea of bicycling in very polluted environments, people are beginning to say, well, why would people put themselves at risk in that way? So the socioeconomic is around bicycling seems to have shifted. I don't know what your thoughts are on that.
In many ways, yes. I mean, first of all, I think bicycle came as a really posh and luxurious transport, and also as a leisure. So you would see those marvelous pictures of people in the castles and with bikes, rows of bikes. And then, it came to be the labor workers, really means of transport. And somehow this culture still sticks today, especially when you see a city that is not, doesn't have a democratic space for cyclists and pedestrians. And I think what the shift is being done now is basically looking at this democracy of space in the streets and saying that a cyclist or a person on a bike, on a like $100 bike, has the same rights of going around as a person in a $300,000 cars, So this is, for example, the concept that Enrique Peñalosa brought to Bogota in the 90s. That was the big message. I mean, we have to see these people in different conditions the same way. And one of the reasons we have walking and cycling so strong in developing countries like Brazil, also India, is because the lack of accessibility to public transport and lack of resources to pay public transport, or even any other kind of transport like car, motorbikes, or any other way. So there's also part of the thing, we're walking and cycling more, not because we want to, or because it's a nice way, it's healthy, but just because we don't have another option. So, of course, we need to keep that up, the numbers, but we need to bring the positive side of it also. I think that's where health comes in.
And Arvind, you talked earlier about your own experience as a clinician and the type of patients you're now seeing. I wonder if you could quickly summarise. You gave a longer talk, but it's a very powerful message that this is the population you're seeing is changing.
Yeah, so over the last 30 years that I have been practicing chest surgery, I have seen a major change in the patient profile, and particularly as far as lung cancer is concerned. So 30 years back, I was seeing mostly smokers, mostly men, and people in 50s and 60s who were having lung cancer. Whereas recently, when I analyzed my last few years' data, I found that the distribution has changed from 80 to 90, 80-20 or 90-10 to almost 50-50. In my latest analysis, there were as many so-called non-smokers as smokers. There were more women in this group, so there were about 40% of the patients were women. There were many patients in 30s and 40s, which was almost unheard of 30 years back. And another major change that I'm noticing as a chest surgeon, and that's something which really hits me hard at a personal level, and I feel very sad about it, that when I discharge my patients after surgery, I have to prescribe an inhaler with steroid to every patient. And how did I do that? When I was discharging these patients, they were coming back to me with cough, persistent dry cough. And I would do a chest x-ray, sometimes I would do a CT scan to figure out what is the problem. And there is no obvious reason. And then someday, to some patient, I prescribed an inhaler, thinking that maybe that's the reason. And the cough went away. And then I realized that actually, then I discussed with my pulmonologist and anesthetist, and we realized that we put a tube down the windpipe for the breathing. And that does cause some amount of inflammation in the windpipe. And when the person inhales these toxins in the presence of that little inflammation, you have excessive cough. So I was giving them local steroids and bronchodilator, and the cough goes away. That's a very sad way of managing your patients, but then there is no alternative.
It is a very powerful story, I think. Richard in the UK asks, and this is a question perhaps for Maria, that the head of the WHO said that air pollution is the new tobacco. Do you agree?
That was a sentence to do exactly what is happening, raise awareness. Tobacco 40 years ago, it was something that it was accepted socially. Everybody was smoking at the cinema, in the elevator, at the restaurants, at home, in front of children, at the hospitals. It was socially accepted, and the evidence was more or less there until, with the evidence generated from the health sector, we started to put in place many measures that the governments now were putting in place until the day we reach as far as a framework convention on tobacco. So clearly the tobacco battle is not yet won, unfortunately, but the air pollution battle needs to copy many things and emulate many good things that came from the tobacco battle. So in that sense, I think it's an analogy that captures very well that we will need to replicate responses by governments, and this goes on many, many sectors and will require very serious societal changes. On tobacco, we changed the fact that before smoking was glamorous, and now if people smoke, they cannot say, I didn't know. Here on the air pollution is different, because you still, you might know the risk that this represents for your health, but you still don't have the choice.
Yeah.
It's not a behavioral or a choice. If you live in New Delhi, unfortunately, you don't have the choice. So that's why we need this big battle against air pollution, as we did against tobacco, and as we will keep still doing against tobacco.
Can I just
Yes,
add on
Arvind,
that?
go ahead.
So, as far as damage and inability to avoid the damage is concerned, I think air pollution is much worse than tobacco. Why? Tobacco, you were smoking by choice. You know, breathing is not by choice.
Not choice.
I know that while taking breath, I'm damaging myself, I'm killing myself. Still, I cannot avoid it. So that's where air pollution is very different from food pollution and food being poisoned, or water pollution. If you know your water is polluted, you can wait for up to 5 days to get clean water. But if you know your air is polluted, you cannot wait more than a minute to get clean air. You have to breathe it. Whether you live or you die, you have no choice.
What would the most important and effective actions be for delegates who've been at this meeting and the people listening to this live stream? What would the most important actions they could take to move this forward? What's the one message that you can send to world leaders on the final day of the conference about what we need to do to address air pollution? JP?
Well, I think, we're doing voluntary commitment as the Brazil civil society organizations. So I think bonding to that, definitely updating to the WHO air quality emission standards, which we are way behind, as well as, for example, simple solution that can shift a lot or reduce a lot of the emissions is to adopt the Euro 6 fuel emissions standard. That would be also a major change for Brazil. We've already been doing the studies, and we could reduce in 80% the amount of PM 2.5, for example. So that would be a major change. And the third point, which is the major point or the key message I gave on the plenary session this morning, is connecting public health into two big subjects, which is air quality is one of them, and that's the main topic we're talking here, but then connected also to physical activity. And we have a really important document also from WHO, the Global Action Plan on physical activity, but we need to bond those two policies together, air quality and physical activity. And I think that's also a message that we have in our commitment as well. And it would be interesting to also promote that and commit to that document.
And that will require legal change, law change, will it?
A legal framework in many ways, nationally, and also how to stimulate cities to do different measures as to promote physical activity, and that can be done also through active mobility approach, for example. So that's why I'm focusing so much on active mobility, but also in a general way on how to exercise more, and with the active mobility actually reducing the damage caused by either motorcycles or even cars in that sense.
Thank you very much, Arvind.
I agree with everything that JP said, but I have a different way of putting it. I would say that the single most important key message that should go out to the world from this meeting is that the health ill effects of air pollution have reached a stage where it's not a question of choice. For me, if I may be allowed to use that word, I would say it's an international health emergency. It's not an option to do or not to do. It's an option, only one option, to do, and do yesterday rather than tomorrow. So putting health ill effects in their proper perspective, getting a grip of the magnitude of the problem, it's huge. The amount of death, disability, disfigurement, sometimes absence from work, and so that's one, that health is almost, this health ill effect has reached a level of international emergency. That's number one. Number two, oftentimes an argument is given that if we take corrective measures, whether it is in automobile, whether it is in power sector, coal sector, wherever, oh, it's going to be very expensive, so we are poor, we cannot afford it. That argument is not valid. The consequences of the health ill effects are so expensive that any amount which is spent on cleaner environment will be worth it. So I think these are the two most important primary points. Once you accept these 2 points, the corrective actions will automatically flow, which will mean important changes in the transport sector, power sector, walking, bicycling, all these things will follow automatically once you accept that, okay, I have got to change, I have no choice.
Thank you. And Maria, if I can press you on the legal and political framework that needs to be achieved with the powerful fossil fuel industry fighting every step of the way, what do you see as the way forward?
Tomorrow we will launch a call for urgent action. No doubt that this is an emergency and we need to do something about that. We need to make sure that everybody understands that 7 million deaths are unacceptable. So we need to reduce that figure, and we need to give us even an ambitious target for that. We need to make sure that the countries will endorse the WHO guidelines, and to do that, obviously fossil fuels will need to become fossils, which is exactly the prescription. So we will have a transition, a healthy energy transition, but we need to start to say tobacco kills. Maybe we need to say as well that fossil fuels are killing us as well, and pollution is killing us as well. So the little red, thing that we put it on tobacco, we might put it on many other things now.
Thank you very much indeed to the panel, to JP, to Arvind, and to Maria, and I hope you've enjoyed listening, and do keep in touch with this particular initiative and unmask your city wherever you are. Thank you very much.
Thank you.